Broadcast is now starting. All attendees are in listen-only mode.
Hello, everyone, and welcome to our webinar where we'll be discussing top reasons for medical billing denials and how to avoid them. All lines have been muted. The webinar will last 30 minutes and we will have dedicated time after the presentation for Q&A. If you have questions throughout, simply type them in the chat box and we will address them during the Q&A time. This webinar is being recorded and will be available for download on the iCare Leaders website by next week. Our speaker for today is Jessica. Jessica is a client revenue manager here at iCare Leaders. Thank you for taking the time out of your busy schedule to join us today. At this time, I will turn the webinar over to Jessica.
Perfect. I hope everyone can hear me and see my screen. Thank you, Courtney, and thank you for joining. Again, my name is Jessica, and I'm going to review some of the top medical billing denials and how to avoid them. What is the difference between a denied and a rejected claim, and how can we avoid them? Denied claims, they are defined as claims received by the payer, but they are marked unpayable. Some of the common reasons for a denied claim include the following: a lack of prior authorization, whether the authorization was not obtained or attached to the claim during the submission of the to the payer. Missing information such as an invalid insurance ID number, or invalid or missing patient demographics, and non-covered or considered not medically necessary by the payer. Majority of the denied claims must be corrected with the submission of an appeal, a corrected claim, or a reconsideration request based on the payer's requirements. These can vary per the payer and per state. Rejected claims usually contain one or more errors found before the claim was processed or accepted by the payer. Top examples of a rejected claim: coding such as an invalid or expired diagnosis code, the CPT was not linked to the correct diagnosis code, patient's policy has terminated, or transposed digits in the ID number, the patient's name, or their date of birth. These errors can be fixed and resubmitted as the claim was never accepted by the payer. Some rejected claims can be caught by the clearinghouse and resubmitted to the payer. Now we can look at some examples of eligibility denials. They contain errors or omissions in documentation or verification, such as typos in creating mismatched data, the coordination of benefits between the primary and secondary or the supplemental plan. It is very important to verify with the patients at the time of service which insurance plan is primary or secondary. Your staff can also ask if the patient has received any coordination of benefit documents recently from their insurance plans. The patient's plan or benefits have changed since they were last seen, or the coverage has terminated. It is always very good practice to verify with Medicare or Medicaid patients if they have a managed care plan to bill instead of the traditional plan. And here are some ways to prevent eligibility denials. Training your staff. In most cases, your front desk staff is going to be the front line in dealing with your patients. Training your staff to understand what can cause denials is one of the biggest ways to avoid simple eligibility denials. Having a process in place for double checking that the patient's details were entered into the system accurately is a great way to catch simple keying errors. Make sure the staff has entered the primary insurance in cases with multiple insurances. Checking the patient's eligibility prior to the appointment reminder call is a great way to catch terminated policies. That way you can inform the patient at the time to bring in their most updated insurance cards. And many major payers have real-time eligibility checks that can be utilized instead of taking the time to call the insurance. Prior authorization denials are another top payer denial. Common prior authorization denials include failure to obtain authorization before services are performed, failure to include the prior auth on the claim prior to submission, failure to obtain prior auth for all services or procedures on the claim, unable to get the prior auth prior to the treatment, and even sometimes when we submit the prior auth and include it on the claim, the payer still can deny it in error. Even when prior authorization is obtained, it doesn't always guarantee payment. The provider should always document medical necessity to ensure the services are supported. The provider should make sure that a prior auth is scanned and documented to be submitted with the claims to the payer. No payer specifics in which services require prior authorization and obtained prior to the appointment. Many payers have different guidelines for prior authorization, so it's very important to verify and keep record of the payer specifics. In emergency cases, services providers should support medical necessity in documentation if the auth was not obtained prior to their treatment. Being aware of services that are not authorized and having the patient sign an ABN of non-coverage, that's in case the provider would like to bill the patient for any unauthorized procedures. And verifying which payers will consider retro authorization with a reconsideration and supported medical documentation. Not obtaining referral from the primary care provider prior to services can also result in payer denials. Patients with HMO or health managed organization require referral from the primary care except in emergency cases. The provider should definitely document if it was an emergency case. Always review the referral to make sure the appointments and services are within the time frame documented on the referral and how many visits the referral covers. Services must be considered medically necessary to treat the patient's medical condition to avoid payer denials, utilizing the proper diagnosis and procedure codes for services provided, and following LCD and NCD guidelines per payer specifics. Avoiding medical necessity denials includes staying updated with current ICD-10 diagnosis codes, using correct modifiers, improving documentation processes, and staying updated on LCD and NCD medical necessity guideline changes as they frequently change and can differ between payers and states. LCD guidelines are decided by Medicare or Medicare contractors to cover a particular service. The LCD guidelines are a great tool to assist in submitting correct coding for services rendered. NCD describes whether specific medical services or procedures can be paid under Medicare guidelines. LCD and NCD guidelines are very important and provide details on specified CPT codes, including description and details. They list payable diagnosis codes that should be linked to the specified CPT code. They can also verify how often a service can be performed and provide guidelines to support medical necessity. Missing or invalid modifiers can also result in many denials from payers. Modifiers provide additional information to report or indicate a service or procedure that was performed, such as medical procedures performed during the same encounter, why the procedure was necessary, where the procedure was performed on the body, and how many surgeons worked on the patient during the encounter. When reporting modifiers, always list the modifier that directly affects the reimbursement if multiple modifiers are being used. The functional modifier should be listed first and the informational modifier listed second. Functional modifiers affects the reimbursement and pricing for the payer's allowed amount. Informational modifiers provide information about the procedure performed or location on the body. To avoid the medical necessity denials, it is most important for your provider to support medical documentation in the services provided. And do we have any questions?
All right, thank you. Yeah, Jessica, so that wraps up the webinar piece. If you have questions, go ahead and drop them in the chat box and we will go through those. So we have had one come through so far, and it is, how can you verify if a referral is needed?
I would always suggest to have the patient review their card. Typically, if there's like a primary care physician listed on the card, or if it says HMO, Health Managed Organization, those are always good ways to identify if a referral is going to be needed before the patient is seen.
Okay. The next one is, why is it important to get a copy of front and back of the card each time the patient is seen?
Now, that's a good question. The front and the back of the card are both very important. The back of the card usually is used more for the billing purposes as to where to mail claims and contact phone numbers. Of course, there's, insurances such as, United Healthcare. They have a lot of different addresses to make sure we're submitting it to the correct address. Even sometimes if we have the same correct payer ID, it's always good to make sure we have all the correct documentation if we are getting denials or rejections to be able to follow up with the insurance.
Okay, thank you for that one. Next one, where can you find LCD guidelines and updates?
Majority of the time you can find these on the Medicare website, the local, I know there's different websites per Medicare. Also, I always think it's good to utilize Google. Often you can find these, but typically you can go to Medicare's website. Some of them have built-in tools that you can type in codes and type in the LCDs, and it will bring up that information. I would suggest always keeping one on hand. They do come really in use with making sure following the guidelines prior to submitting the claim.
Okay, great, thank you. Where does the prior authorization need to be listed on the 1500 form?
Let's see which box it goes in. It does need to be it can be located in a couple of different spots. Of course, it will be dependent on which system you're using. And I don't have a HCFA right in front of me to look at the actual line that it has to be submitted on. So I could get back to you on that. I just have to look at the copy of the 1500.
Okay, no worries. And if you ask that question and we're not able to get back to you today, then we will follow up with you. We do have your email address. So just in case we're not able to get that question answered for you today, we will follow up with you. The next question is, do you guys offer RCM services? We do, and once this webinar is over, once I close it out, if you're interested in learning more, or if you think of questions afterward, feel free to just put your name and email address and any questions that you have, and we will absolutely follow up with you. Let's see here. Jessica, do you want me to move on to the next question, or do you want to look for that on the form?
Yeah, you can move on while I'm looking for it. That works just fine for me.
All right. It looks like someone said, or actually a couple of people, thank you for your help. It looks like they've said box 23. Okay. And we can have Jessica confirm, but we did have a couple people say box 23 for the authorization piece. HMO insurances require insurance referrals with a referral number, not a PCP referral. Is this correct? Usually they have an IPA, a doctor-to-doctor referral will not work. Is this correct? And I might need to repeat that one, or again, that might be one we need to follow up on.
Can you repeat that for me one more time, please?
Sure thing. So HMO insurances require insurance referrals with a referral number, not a PCP referral. Is that correct?
That is one I will definitely look into. I do not know that one off the top.
All right, so we will, if you ask that question, we will follow up with you on that piece. And then will this webinar be available after the call? Yes, absolutely. So if you go to icareleaders.com, once there, you can click on resources, and under resources, you can select on-demand webinars, and that's where it will be uploaded to. It usually only takes us a day or so, but we like to, give ourselves a grace period. So just in case, if you don't see it by tomorrow, check back early next week and it should be there. You can also find our scheduled live webinars there as well. So any future webinars.
And to loop back on that authorization on the 1500, correct, it is box 23. It is right below where you do the resubmission code for a corrected claim.
Great. All right. It looks like that was the last question. So again, if you have any other questions after the fact, you can put your name and drop that question once the webinar is closed out, and we will follow up with you. We want to thank everyone for their time today. And again, this webinar will be posted online so that you can download it and view it whenever you'd like. Thank you all and have a great rest of your day.
Thank you, everyone.